Hello, welcome to this short where we are talking Kussmaul respirations. Respirations that are characterized by deep, regular, rapid, sustained respirations. This is in response to metabolic acidosis primarily. So we're going to see this in three patient category groups. We have diabetic ketoacidosis, renal failure, and your septic patients who are acidotic. What's going on here, we talked about this in our Cheyne-Stokes respiration, our brain makes adjustments at our respiratory pattern or on our respiratory patterns in response to what's going on metabolically. We have chemoreceptors that pick up carbon dioxide levels and they do things based off of those. So what's happening here is your body is recognizing that I have an accumulation of acidic compounds and my pH is way outside homeostasis. My pH is low, which means I am acidotic. So what it does in an attempt to correct this is a good compensatory mechanism. Okay, this is not a thing that you necessarily want to interrupt or try to stop, but it picks up on that low pH and that high acidity, and it says, hey, we need to get rid of carbon dioxide to try to buffer that number so that we can inch closer to our homeostatic ranges. That's what's going on with Kussmaul respirations. Again, it's very deep, rapid, sustained respirations. You don't need to intervene in those necessarily, but more work with them in conjunction and support oxygenation efforts. So you may need to apply supplemental oxygen, you may need to assist with the bag valve mask. Look at your patient and, depending on what you're seeing in front of you, will depict what type of intervention you might need to do. But an overarching goal, I'm going to say, is support oxygenation efforts of the body. Anticipate this individual to potentially decompensate. We are working hard to try to correct something that's abnormal, and so you can only do that for so long before you decompensate. And so look for respiratory fatigue in these patients and anticipate that and what you're going to do in the next step to take over for them, whether that's supplemental oxygen, whether that's an adjunct, whether it's a more established airway. Again, look at your patient and what's going on in front of you, and that will kind of guide you to help make that decision. So that's Kussmaul. In short, let's just wrap it up here. It's the brain's response to metabolic acidosis. That leads to an increased respiratory rate, which will drive carbon dioxide levels down in an attempt to try to buffer that pH. So CO2 comes down, pH should, in theory, creep up. These are sick patients, and this is just one more thing that you can use when you're looking at that patient trying to chip away at a differential diagnosis. If you see that deep, sustained, rapid respirations, maybe in the back burner of your brain, think, okay, I might be dealing with an acidotic patient. Let's gather some more information. Let's grab a glucose. Are there any signs of infection? Let's listen to lung sounds, maybe pneumonia. Look for ulcers, areas of the body that are not healing, perhaps some cellulitis. Look at your patient. That's Kussmaul. Thanks, guys.